Chapter 17, Function of the Heart. Define the cardiac cycle with respect to systole and diastole. Describe the autonomic innervation of the heart, including sympathetic and parasympathetic innervation. Define cardiac output, including the following. Describe the effect of Starling's law of the heart on cardiac output. Describe the inotropic effect on cardiac output. Explain how changes in heart rate and/or stroke volume change cardiac output. Define specific clinical vocabulary used to describe cardiac function. Define preload and diastolic volume, and explain how it affects cardiac output. Define afterload and identify the major factors that determines afterload. Define chronotropic, inotropic, and dromotropic effects. Define heart failure and differentiate between right-sided and left-sided heart failure. Key terms: afterload, cardiac cycle, cardiac output, cardiac reserve, chronotropic effect, diastole, dromotropic effect, ejection fraction, and diastolic volume, heart failure, inotropic effect, preload, pulmonary edema, Starling's law of the heart, stroke volume, sympathomimetic, systole, vagolytic, vagomimetic, and venous return. Okay, summary outline. The coordinated and adaptable pump. Cardiac cycle. The cardiac cycle is a sequence of events that occurs during one heartbeat. The events of the cardiac cycle include atrial and ventricular systole, contraction, and diastole, relaxation. Heart, autonomic control. The autonomic nervous system allows the heart to respond to changing body needs. I'm going to say that again. The autonomic nervous system allows the heart to respond to changing body needs. Stimulation of the sympathetic nerves increases heart rate, SA node, conduction velocity, AV node, and contractile force, myocardium. Stimulation of the parasympathetic nerves, vagus, decreases heart rate and conduction velocity. So S for stress, sympathetic, P for peace, parasympathetic. Cardiac output and venous return. Cardiac output is the amount of blood pumped by the ventricle in 1 minute. Cardiac output is determined by heart rate and stroke volume. Many factors can change heart rate and/or stroke volume. Venous return is the rate of blood flow back to the heart. How stroke volume can be changed. It can be changed by Starling's law of the heart regarding stretch, and it can be changed, stroke volume can be changed by an inotropic effect, which is non-stretching. Heart talk includes the definition and description of commonly used clinical terms such as preload, afterload, ejection fraction, inotropic effect, chronotropic effect, and dromotropic effect. Heart talk receptor terminology includes the definitions of beta adrenergic receptor activation, beta 1 adrenergic receptor blockade, muscarinic receptor activation, and muscarinic receptor blockade. The failing heart when the heart can't pump, left heart failure. The left heart can fail, producing symptoms caused by a backup of blood into the pulmonic circulation. Pulmonary edema, referred to as backward failure. The failing left heart is unable to pump enough blood to the systemic circulation, producing symptoms related to poor tissue oxygenation, referred to as forward failure. Right heart failure, blood backs up behind the filled right ventricle, causing jugular vein distension, hepatomegaly, splenomegaly, digestive problems, and ankle edema.